This stinks, guys. This really stinks. You've seen the title of the video, right? So you know what I'm going to tell you. My ear surgery was a failure. I still have a big whopping hole in my eardrum, same as it ever was, and it's it's just really frustrating. I don't know. Um, I just found this out a couple days ago. I was pretty sure I blew the eardrum about 5 days ago. Um, I traveled and I got a bit sick, and I got what I would describe as a very mild to moderate sinus infection. It really wasn't bad for me, actually. I've had much, much worse sinus infections in my life. But I was blowing my nose, and in doing so, I apparently blew my nose one time too many or one time too hard, and could hear and feel the air rushing out of that ear, which for those of you with normal eardrums, you know that you don't normally experience that. And that was my indicator. I knew right then and there. I was like, absolute crap. I did it. That was it. And I heard and I felt that sensation another couple times over the weekend. And then finally, 2 days ago on Monday, I decided to look I have like a little ear camera, ear cleaner device. And sure enough, it, it was there. Big old hole. So it's a freaking bummer. Funny enough, the surgery was no big deal. I still do intend to make a video about the actual procedure and what to expect because it's not an uncommon procedure. And if you look on YouTube or if you look on the internet, there's not really a lot of information telling people what to expect for this surgery. So I do intend to make that video still. I have all my notes. I've got everything prepared. I just haven't had a chance to get it done. Among the reasons because we moved. But I am hoping to put that on this channel in the next month or two, perhaps. But yeah, the surgery itself wasn't bad for me. I went in with no stress, no anxiety around it whatsoever. I knew that I handle anesthesia like a champ. I knew I was in good hands. I went into it like an old pro. I mean, this was my seventh ear surgery, so I kind of am an old pro at this point. But I was very comfortable, very confident going in. I knew I was safe. I knew nothing bad was going to happen. And I have a really great surgeon. I think he did the best job he possibly could. But, it is what it is. And, in the last couple days, I've found myself wondering if I still want to get the other ear done. Because my plan with the American healthcare system being the way it is and needing to plan out your medical care the way that sometimes we do, I figured if I was going to do the ear surgery at all, I would have to get both of the ears done in the same calendar year because then it turns into a buy one, get one free deal. And, we only pay the max out of pocket one time during the year. So now I'm finding myself questioning if I should even attempt the other ear, right? Because the definition of insanity is doing the same thing, expecting a different result. I feel like I'm starting to run into that sort of situation. And it's not that I'm not optimistic. I'm actually a very optimistic person by nature. But, on the one hand, I want to be optimistic. On the other hand, I want to be realistic and just kind of see the writing on the wall. So I'm hemming and hawing over that. I don't know. My plan was to get the other ear operated on in November. I'm really leaning towards not doing that anymore, which sucks for a couple of reasons. I really wanted my ears to be waterproof so I don't have to worry about going to swimming pools in the ocean and worry about getting a massive ear infection from this hole in my eardrum, or eardrums, plural. But yeah, I don't know. I don't know if I'm going to end up doing the other one in the fall. I'm leaning towards no. And you guys are going to see tomorrow. I'm actually posting a brand new video tomorrow about what the antibiotics did to my microbiome. You guys who have followed this channel for a while already know this, but for newbies, I have done, let me think. Well, I did 23 ombre tests on myself in 2022. And then I did another 6 Biome FX stool tests on myself in like early November and then January for the veggie mashup experiment video. So I have almost 30 stool tests from the previous year. And then I did more stool testing when I was 6 weeks post-op, and I compared the before and after. And guys, I'm shook, as the kids would say. The amount of change in my stool testing from one single dose of clindamycin at the hospital is astonishing. Astonishing. So I'm also factoring that into the mix is, surgery is not without risk. Anesthesia is not without risk. And now I understand the single dose of antibiotics that they gave me at the hospital is certainly not without risk. And you couple this with the failure of the first ear, and I'm just really leaning towards not getting it done. We're going to see. We'll see if I have a change of heart. But, I've hypothesized for a little while that the reason why I kept blowing my eardrums and they could never fully take and never fully heal was because I have this history of sinus and nasal issues. They've gotten a lot better in the last 10 or so years. You guys don't even know. Before I went to chiropractic school and got all hippy dippy crunchy and changed my diet, I was getting 3 or 4 very severe sinus infections every single year. All of them virtually I would take antibiotics for. And I had chronic allergies. I was on, Singular and Claritin and Flonase and all of the stuff for allergies. And I was still nasal. Now, because of the glory of YouTube and the internet, sometimes I get unhelpful comments like this recent one. But I'm aware that I still have a little bit of nasaliness to my voice, but honestly, I don't care. Let the haters hate. I don't care because I know how far I've come and I'm so proud of that. And honestly, there's this element too where after everything I've been through and what my microbiome has been through, we all have weak links in the chain and we all have predilections, right? So some people, if they become inflamed or unhealthy, their skin is the first thing to show them that. For me, it's a sinus thing, right? I'll get a sinus infection or get stuffy. So I don't know if I want to nitpick on my predilection to sinus things versus somebody else's predilection towards itchy rashes versus something else. I don't know if I want to nitpick that too much. I'm comfortable saying that that might just be like my tendency when things get weird for my body. But it was a risk factor I knew about going into this. I knew that I would have to be super careful to not get sick initially after the surgery. And I'm so proud that I did. I did not get sick for the first 13 weeks post-op. Like over 3 months, I was able to go and not get sick and not have to blow my nose at all for 3 whole months. And this is kind of where I start getting into this mental funk of not wanting to get the other surgery done is they tell you in all the handouts that you're not supposed to blow your nose for, I think it's either 4 weeks or maybe 6 weeks. I think it was 4 weeks though. So they tell you not to blow your nose for 4 weeks, which implies that you would be safe to do so after that point. But I didn't blow my nose really at all until I was 13 weeks post-op. If my anatomy and my physiology, if my body can't handle blowing my nose at 13 weeks post-op, who's to say I had a snowball's chance in hell, right? Of having this eardrum stick around. So it's this sort of stuff that I'm kind of noodling on and thinking about. And honestly, I'm just kind of mourning the loss of that eardrum. Everything that went into this. I'm just kind of mourning it and dealing with that right now. On Monday, thank God I had a very light patient workload day that day. And I found out in the morning, and then I just kind of allowed myself to mope around for a lot that morning and not get anything done. And I think that can be important sometimes is letting yourself be in a funk, letting yourself mourn the things that you want to mourn. I think that in America, certainly, we have this culture of just like pick yourself up and get on with your day. And I did do that to some extent, but I laid in bed and watched K-pop videos and thought sad thoughts for a couple hours. And that's just how the cookie crumbles. I will say too, I had this epiphany, or I had this moment where I laughed and I thought of a lot of you. I was talking to my husband about it, and this was right when I took a look, and he was there. And I made this comment about my stupid ear. And then I kind of zoomed out and I said, whoa, this is the sort of stuff I talk about with my FODMAP Freedom students and my patients. And I think I've talked about it here on this channel a little bit, certainly on the IBS Freedom podcast as well. But when we are dealing with a health struggle, oftentimes there's this dialogue of really being down on your body, right? There's so much inner dialogue for many of you that is either, why is my tummy out to get me? Stupid stomach. Why can't you do your job right? You have one job. My stupid stomach, my crappy stomach. Oh, like I hate my stomach. I hate my intestines. I hate my microbiome. There's a lot of that sort of inner dialogue, I find. And I only know that because I had that a lot when I was going through my struggle with IBS. And I remembered that. And I have mentioned that in classes and webinars. And when I bring that up, a lot of people confess that they have those thoughts now in their health journey. But I thought it was so fascinating that even with, my perspective and doing this, coaching people through this for a living and knowing what I know, there was still that part of me that defaulted back to my stupid ear. And it was just kind of a mind, what, rhymes with duck. And I think that this is another one of those instances where perfection is not the goal, nor is that an obtainable goal, right? Again, I know that saying things like that will not serve me ultimately, but I still had that kind of knee-jerk reaction. The key, I think, is when you can catch it early on and you can kind of prevent that vicious cycle from perpetuating versus if you get stuck in that style of thinking for months or years at a time, that's much more difficult to overcome. That's much more difficult to pull yourself out of. So I guess this is just another lesson in comfortably demonstrating imperfection to you guys so that you know that you don't have to be perfect in any of this. And that's okay. We all have intrusive thoughts. We all have kind of crappy thoughts every now and then. Sometimes we get sad. Sometimes we mourn stuff. Sometimes we just need to take a freaking break. A lot of you will probably notice I've been a little bit MIA from the YouTube comment section lately. I just haven't had it in me. I've had such a bizarre and stressful 6 or so months. Honestly, it all kind of started with DSL threatening to sue me, and everything just kind of snowballed after that. It's been a really odd 6 months. So I'm actively working on that, and I'm taking a lot of adaptogens and Nervines to try to help me get through this weird season of my life. But I'm committed to staying here on YouTube. I did an Instagram post and I said, Instagram is really low priority for me. Typically, I like it. I just don't prioritize it as much. My top priorities, in addition to FODMAP freedom and my patients, obviously, my priorities are always going to be this YouTube channel and my podcast. So you'll still see me here. Like I said, the antibiotic episode or video is coming out tomorrow. So look forward to that. It was honestly astonishing. I am actively rehabbing some of my gut microbiome inhabitants right now, and I'll probably do follow-up stool testing at the end of the summer to kind of check in on everybody. I want to give them a good solid 6 months of rehab before I go about measuring anything. just thank you for being here on this journey and for this rambling update video. No education here probably whatsoever, but this is just my update and I wanted to share. And 99% of this channel is education and I'm trying to help you guys, but there is that little sprinkling of vlogs and my updates and my musings. And this is just another one to add to that collection. But a lot of you were so kind in your comments, wishing me well after that surgery and wishing me a speedy recovery. Somebody had a really great comment about welcome to the waterproof club or something like that. I'll have to put that on the screen too, because that was great. So I kind of felt like I should update you guys on what admittedly is a bit of a bummer, but life moves on. And if having holy eardrums is the worst I have to deal with, I suppose that's not the end of the world, but I'm still allowing myself to feel bummed and frustrated that the outcome was not what I wanted. So that's all I got.